Ontario's Chief Medical Officer of Health offered what many could have considered a light at the end of the tunnel, saying yesterday the flu season may have reached its peak, but local health experts say parents should still be mindful over the next couple of weeks. Local health experts say Dr. Kieran Moore's statement that Ontario's flu season may have reached its peak is both encouraging.
Based on what we see, yes, it looks like we did indeed peak.
But also point out that the drop-off isn't going to be quick.
We typically see that flu season goes up for about 8 weeks and then comes down for 8 weeks.
Infectious disease expert Dr. Dominic Mertz says pediatric admissions are declining in Hamilton, but may lag behind the provincial trends by about 2 weeks.
It went back to normal, or back to what's expected for December in the school-aged group since the first week of December. In the younger kids, and those are the ones that are responsible for the majority of hospital admissions, we are still above of what would be expected. So that 0 to 4-year-old population, we are declining, but still much higher than we would expect.
Mertz points out that while flu season may be at the midpoint, other viruses exist and are still the main cause of admissions.
Roughly 60% of our patient days in the Children's Hospital were due to RSV. So the majority was RSV, 20% flu, and 20% other viruses. That includes COVID, which was responsible for about 3%.
Niagara's Chief Medical Officer of Health, Dr. Mustafa Hirji, says the holiday season may alter the downward trends.
There's going to be lots of gatherings among people. It's, finally probably going to hit us where we get proper winter and it's snowy and we're going to be indoors much more. And that's really going to set up ideal times where infection keeps spreading.
Which means vaccination against viruses like influenza and COVID are important.
Good uptake of the flu vaccine since we've started offering it as a drop-in through our Lime Ridge Mall Clinic, as well as our mobile vaccination clinics. And that's ranged between 100 and 150 doses per day or so.
Dr. Moore also predicted that COVID cases could rise in January. Dr. Dominic Mertz says it's possible since cases are so low right now. Well, starting next week, the specific bivalent booster doses for kids 5 to 11 will be available.